Beware, 9 popular medications that can trigger rapid dementia after 60. Because while we often blame genetics or lifestyle for cognitive decline, recent pharmacological breakthroughs suggest that the very pills sitting in your medicine cabinet right now might be the hidden culprits behind pseudo-dementia, a reversible but terrifying state of rapid memory loss that millions of seniors are misdiagnosing as Alzheimer's. Stay till the end because the single most common over-the-counter pill, taken by nearly 1 in 3 adults for a completely unrelated issue, has been linked to a 54% increased risk of developing permanent cognitive impairment when used long-term. Starting at number 9 are benign-looking antihistamines, specifically first-generation types like diphenhydramine. Millions of seniors reach for these to help with seasonal allergies or as a gentle sleep aid. However, these drugs are highly anticholinergic, meaning they block the very chemical your brain needs to maintain focus and short-term memory. A massive study published in JAMA Internal Medicine tracked nearly 3,500 seniors for 7 years and found that those using these drugs at high doses for just 3 years had a significantly higher risk of dementia. The mechanism at play is the cholinergic void, where the brain's signaling system essentially goes quiet, mimicking the symptoms of early-stage Alzheimer's. A practical tip is to switch to second-generation antihistamines like loratadine or cetirizine, which do not cross the blood-brain barrier as easily. This category receives a neurotoxic score of 6/10 because the damage is often cumulative and insidious. Number 8 involves over-the-counter sleep aids. Many people don't realize that PM versions of popular pain relievers often contain the same anticholinergic ingredients mentioned above. In the aging brain, these substances don't just cause sleepiness, they cause nocturnal delirium. This is a state where the senior becomes disoriented or agitated upon waking. The mechanism of harm here is the disruption of REM sleep architecture, which is when the brain flushes out metabolic waste, amyloid plaques. By chemically forcing sleep, you might be preventing the brain from cleaning itself. The practical implementation tip is to utilize magnesium melatonin cycling under supervision, focusing on natural precursors to sleep rather than chemical blockers. The verdict: if it has PM on the label and you are over 60, it's a high-risk habit that needs an immediate audit. Coming in at number 7 are benzodiazepines, often prescribed for anxiety or insomnia. Think diazepam or alprazolam. While effective for short-term crises, their long-term use in seniors is a primary driver of rapid cognitive descent. These drugs act as central nervous system depressants, but in those over 60, they have an incredibly long half-life, meaning they stay in your system for days, not hours. Research from the British Medical Journal linked benzodiazepine use to a 51% increased risk of Alzheimer's disease. This is what we call the sedative accumulation effect, where the brain never fully clears the drug, leading to a permanent state of slowed processing that looks identical to dementia. The practical tip is to work with a doctor on a slow taper protocol, as stopping these cold turkey can be dangerous. The next items on our list are even more surprising because they are often taken for heart and stomach health. At number 6, we have statins, specifically lipophilic ones like simvastatin or atorvastatin. While these are gold standard for cholesterol management, the brain is made of roughly 60% fat, and cholesterol is a vital component of the myelin sheath that protects your neurons. Some patients experience what is coined statin-induced brain fog, a specific type of cognitive wandering and forgetfulness. The FDA even added a warning to statin labels regarding memory loss and confusion. The mechanism is neuronal starvation, where lowering cholesterol too aggressively in the brain prevents synapses from repairing themselves. If you notice a sudden drop in memory after starting a statin, the practical tip is to discuss hydrophilic statins like pravastatin with your doctor, as these are less likely to enter brain tissue. Number 5 covers proton pump inhibitors, PPIs, used for acid reflux, like omeprazole. These are some of the most overused drugs in the world. Recent longitudinal studies found that regular PPI users over age 75 had a 44% increased risk of dementia compared to those not taking the drugs. The mechanism is twofold. PPIs can lead to a severe vitamin B12 deficiency, which is essential for brain health, and may also interfere with the enzymes that break down brain trash or amyloid plaques. This is the nutrient malabsorption gap. The practical tip is to address the root cause of reflux, often low stomach acid or diet, and use PPIs for the shortest duration possible, ideally less than 8 weeks. Ranking at number 4 are bladder control medications like oxybutynin. These are potent anticholinergics. Because the bladder and the brain use similar signaling pathways, the drug that quiets your bladder also quiets your memory centers. The Journal of the American Geriatric Society has repeatedly warned that these medications are often the direct cause of acute confusion in the elderly. We call this urological memory loss. The practical implementation tip is to explore pelvic floor physical therapy or timed voiding techniques, which can manage symptoms without chemical interference with the brain. The score here is a 9-10 because the link between these specific drugs and cognitive decline is remarkably strong. At number 3 are tricyclic antidepressants, like amitriptyline, often prescribed today for chronic pain or nerve issues rather than depression. These are dirty drugs in the pharmacological sense, meaning they hit many different receptors in the body, including those for acetylcholine. In the aging brain, this results in synaptic static, where the brain struggles to form new memories. The practical tip is to look into targeted nerve modulators, or topical treatments for pain that don't have systemic anticholinergic effects. Number 2 is corticosteroids, like prednisone, when used long-term. While they are miracles for inflammation, they can trigger steroid psychosis or cerebral shrinkage in seniors. High levels of synthetic cortisol mimic the body's fight-or-flight response, which over time can actually damage the hippocampus, the brain's memory headquarters. This is the hypercortisol erosion framework. The practical tip is to use steroid-sparing agents or localized injections rather than oral pills whenever possible to protect the hippocampus. The number 1 medication to watch out for is antipsychotics used off-label for dementia-related agitation. Ironically, the drugs often used to manage the behavior of dementia patients are proven to accelerate the progression of the disease and significantly increase the risk of stroke and sudden death. This is the chemical restraint trap. The mechanism is a global dampening of dopamine and other vital neurotransmitters, leading to a flattening of the brain's cognitive reserves. The most valuable revelation is that behavior is often a form of communication for seniors. Addressing unmet needs, pain, hunger, boredom, is often more effective and safer than any mind-quieting pill. To protect your brain, you must implement the Green Cabinet Protocol. First, once a year, bring every single bottle, including supplements, to a geriatric pharmacist for a polypharmacy review. They are specifically trained to spot drug-to-drug interactions that standard doctors might miss. Second, always ask for the Beers criteria check. This is a list of medications that are considered potentially inappropriate for older adults. Third, never accept a new prescription for memory loss without first checking if your current medications are causing the confusion. The single most valuable revelation for anyone over 60 is that brain aging is not always permanent. Many seniors who are told they have early Alzheimer's actually have medication-induced cognitive impairment. When the offending drug is removed under medical supervision, their memory, personality, and sharp wit often return within weeks. The revelation is that you are not losing your mind. You might just be over-medicated. Which of your current medications has a PM on the label or a warning about dry mouth? And have you noticed any changes in your focus since you started taking it?